I wanted to
Okay.
ask, like, you shared about like writing, the pandemic of writing. How did you get into writing?
I've always enjoyed writing since I was little. English was always my favorite subject. Growing up in the South, I think it's kind of like contradictory because every time I go somewhere, people always pick up on my accent. And although, I have kind of like that country accent, I am still very versed in writing. And so it's something that I just took a liking to when I was little. I've always enjoyed writing, whether it be in a diary for research purposes or for class. Writing has just always been one of my outlets throughout my life.
I love the southern accent, and I think people talk about it inappropriately too much. I recently saw a post on LinkedIn. I think someone was saying like my southern accent is professional or something along that
Yes.
lines, and I love that because I think that that's also a lot of what we have to talk about. Just because you speak a certain way doesn't mean that you aren't speaking sensibly or you aren't talking about things. So I appreciate that as well. What was the process like for you from like thinking about the idea of writing a book to then writing the book to then publishing it and whatever else came along with that?
So the whole thought process for the book, it started with me when I got reassigned during the COVID-19 pandemic. I was working as a community health coordinator. Then I ended up being reassigned to become district liaison for the COVID-19 operations at the local health department. And so basically that day, everything changed because I was not versed in, things like COVID-19 and influenza. So it was a new ball field for me. And so really it made me want to write a book. And since I was diving into the field of becoming a doula and being more interested in maternal and child health, I said, hey, I want to do that in a children's book. So that's how that came about.
That's awesome. What has been the reception, or how have you gotten the word out about your book?
Well, it's still in the process of being published. I'm currently working with a publishing company called Newman Springs Publishing. It will be published by the end of the year. It'll be available on Google, Amazon, and things like that, and Barnes and Noble. So it's something that I'm still working on, but it will have a very big, multifaceted campaign to go along with it. So I'm really excited about that.
And if people wanted to tap in with that campaign, where should they go and connect with you? Should they sign up to your email list? And you can share this information with me, and I can put it in the description and show notes for people.
Sure. I can connect them with the person. My email address is assertiveintuition@gmail.com. And they also have a website, which is newmanspringspublishing.com.
Okay, awesome. Well, that's awesome that you're in the path to getting a book published. I hope that I will be there someday soon. So wish me luck. But I'm glad that you're able to do that, and I think it's awesome when we're able to take the skills and experiences and really share that in a way that's tangible for people to kind of understand. Okay, this is public health because
Right.
too often our story is that we don't know about public health until something happens like later on in your collegiate journey and things like that. And I think it's an opportunity missed to not have that conversation. So I'm glad that you're doing that.
Thanks.
What does public health mean to you?
To me, public health is all about the greater good and serving others. When I think about the term public health, the first thing that comes to my mind is equity for all people, and that may be through access to health care or access to healthy foods. Either way, I look at public health as about all about improving the lives and health of individuals within the community.
And you went on to get your Bachelor's of Healthcare Administration at Jackson State University. Walk us through that thought process. Did you begin as a healthcare administration major?
Yes, I did. So I was introduced to healthcare administration by my mom. She completed her degree in business with a focus in healthcare management, which is basically the same thing as healthcare administration. I would read her textbooks all the time, and I became very intrigued with the career path known as healthcare administration. I began researching jobs that one could obtain with that educational background, and I was completely sold. I knew it was something that I wanted to do. I also began to read about different things related to healthcare administration, like jobs such as being a hospital administrator, a nursing home administrator, and also things about public health. Ironically, the healthcare administration program at Jackson State was housed in the School of Public Health. So I had public health courses while in undergrad, which also sparked my interest in public health.
Yeah, well, once again, I think that exposure is important, and however we get it in our lives to get where we are.